The elusive muscle spasm. Diagnosed frequently from GPs and practitioners all over the place, leaves patients somewhat confused and misinformed about what is actually going on in their spine. And we're talking about back muscles and neck muscles, particularly in this video, but it does apply to other areas. Now, muscles going into spasm is not really an appropriate diagnosis, and what we want to explore in this video is give you an idea of what could actually be causing that, because muscles are generally reactive structures. Yes, you can injure them, you can tear them through specific traumas, say for example a footballer tearing the hamstring and it going into subsequent spasm in a football match. But the patients we see here at the Mayfair Clinic, there's not that overstretching in a football game that's caused the muscle spasm. It's putting their sock on in the morning that's caused the quote-unquote muscle spasm. And if you don't understand the causes of that muscle spasm, you're going to frequently prescribe exercises and rehabilitation that is not appropriate, that's not getting to the cause of the problem, and results in the cause, the damage, the injury, getting worse over time. And we don't want that because it leads to poor prognosis, it means you don't get better and you can't do the things you want to do. So what can go wrong? Fundamentally, the muscles in your lower back, in the glutes, and we'll focus on the lower back for this example, but there's substantial similarities to what's going on in the neck as well. The muscles protect this region of your spine, and depending on which segment of the spine becomes injured, you're going to get different muscles going into spasm because they're controlled by different regions of the spine. So if we take the bottom section down here, the common L5S one, it's very common that people will have some element of disc degeneration in there that's causing their back pain, some element of facet joint irritation. You've got other more serious problems like spondylolisthesis, where this part of the bone here has some sort of traumatic fracture and it slips forwards on the front. You can also get things like stenosis, which all affect this region here. But when there's a fundamental damage, injury or trauma to the soft tissues, or unfortunately the hard tissues in this region of the spine, you get an element of muscle spasm. And the problem with the muscle spasm is that most of these injuries are caused by a failure of your lumbar spine, your back, to deal with that compressive load of gravity on a daily basis. It injures a structure and immediately everything tightens up. That's okay for a day or two. But if it starts to persist for periods of weeks, months, or even years, then it's really going to make that compression, that injury worse and be a substantial barrier to recovery. Then you look at other issues like lordosis and those sorts of things that can contribute to the problem not getting better if the lordosis is not appropriate. But fundamentally, what's causing your muscle spasm is an injury in your spine. And if you take the approach of just stretching it and pulling it more, of using heat on the muscles, you're probably going to have the reasons why you're not getting better. You haven't looked at the deeper problem, and that needs to be explored. If you want to read more about that, then definitely head over to our website. We've probably got numerous videos by now that you can see on our YouTube channel that will go into much more detail on the different injuries that you can get in your lower back and how to deal with them effectively. Thank you for watching. For videos on our Back in Shape program and how to get involved in that and work out from home to strengthen your back, click the link right here. For more recent uploads, then right up here. And if you want to subscribe so you don't miss any of our future videos and stay up to date with the latest back care advice, then subscribe to us above. Thanks again.